In this exercise video, I'm going to show you how to do a self-mobilization to an elevated rib. So if you have a rib that seems to be stuck out, and so you're running your hand down, you can feel a big bump as you're coming down, as a rib feels elevated and you're having pain with that rib moving or having pressure or taking a deep breath, that could indicate that you need to do this rib mobilization. And so we're going to want to find where that rib is located, and you should be able to kind of feel the path of the rib, where most of these ribs, especially if we're down lower here, are going to be angled front to back this way. And so if we follow the rib bone, we should feel it kind of wrapping lower down in front and then coming up higher as it goes towards the spine. That angle is important in order to try to stabilize the individual rib and be most effective with this exercise. So we're going to use a yoga stretching strap, but you could also use a belt or even a rolled up pillowcase or anything like that. Nice and skinny, hopefully, to just target that one rib that's elevated. So we're going to find that rib and we're going to follow it. The rib is going like this. We're going to follow it along that way as best we can. And then with our arms here, I'm going to pull on both ends, one on the back side, one on the front side, to help stabilize that rib and pull it down. So pulling both sides, trying to get my arm out of the way, pulling both sides down to try to pull that rib in if it's stuck out. And then from here, what I want you to do is take some deep breaths. So you're going to inhale really big breath. Do not let go of tension on the band as you're inhaling. And then exhale fully. As you're exhaling, you're going to take up the slack and try to pull a little bit farther. You should be able to get a little bit farther, and then inhale again. Don't let the band move. Exhale, pull and take up the slack as we're exhaling, and that rib should be coming down. So using your breath there, you can help guide that rib back down. You can also encourage some rotation with this as well. And so if we're going to add in the rotation, we're still going to have that band around the rib, trying to target it here, holding both sides really firmly. And then we're going to rotate towards that side and then back out. And we're only rotating enough until we feel some pressure or stretch or discomfort right at this level. So we're not looking for a full rotation. Usually we're just rotating a little bit, and we're just holding this pressure on the band as much as possible as we do that little bit of a rotation towards the side that the rib is elevated. Again, that mechanics will help pull it back down. And so when you're finished, hopefully it will be laying a little flatter, and you should be able to have it move a little bit better with breathing and other movements throughout the day. So you want to use the stretching strap, something skinny, find the length of the rib and follow its path at the angle that it is at, and take some deep breaths with some good pressure, and then add in a little bit of rotation at the end, and then the rib should be feeling better and moving better.